I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. Today we have a special guest, a guest that has been known for many years. But more than that, I knew him professionally as well as a plastic surgeon. In fact, he did all of my plastic surgery when I was in practice as such. And plastic surgery is a specialty that is, people want results. If you're not a good plastic surgeon, you better not mess up, because that face and whatever you're doing has to see the public all the time, and that's your signature of being a plastic surgeon. I mean, I don't mean cosmetic plastic surgery. I'm talking about serious plastic surgery from accidents and things like that. And so, Dr. Deas, who I will welcome here this morning.
Good morning, Dr. D.
So nice having you, Dr. Deas. You know, I remember all the times we conversed over the phone about a case, or you told me about cases you've done and things like this. But before we get into plastic surgery and also about your father, who was a doctor, old country doctor, just give me a little background about even getting into plastic surgery, because as I know that it's not that many African American plastic surgeons.
Well, Dr. Deas actually started back when I was a child.
Okay.
I loved to build things.
Okay.
And I was always building something. And then during the World War II, I built model airplanes.
Okay.
Loved to build model airplanes, and beautiful ones too. And then my sister, who had gone away to Chicago to study, for some reason sent me a camera. And I began taking photographs of everything I could take a picture of. And I would take the film to the drugstore, and the pharmacist said, well, it'll take a week for us to get the pictures back from Richmond. We lived down in the country, Dr. Deas. We lived 2 hours from Richmond. We were between the Rappahannock and Potomac rivers on the Chesapeake Bay. I could see the Chesapeake Bay in Virginia.
Right.
I could see the Chesapeake Bay from my attic.
Oh, right.
And so I said, gosh, there has to be a better way. And this is about 1945, and I was 13 years old then.
Right.
So we got to see his Nobel catalog. That was a big event, twice a year.
That's right.
The fall and
Even if you looked
spring.
at the lingerie that they had the pictures of the women in the catalog.
At that age, I was just interested in one thing, finding out if I could get a developing kit to develop my own film, and sure enough I could. And I still have the advertisement from the catalog. I gave it to my nephew as a keepsake. $5.98 I got this developing kit, and I started developing my own pictures.
Okay.
Then my father, who was a country doctor, got an x-ray machine, and he said to me, son, could you come over and develop my film for me? And I was happy to be working in his office.
Right.
And my dad had an extensive library.
Okay.
And I used to look at his books, and then I'd see these images on the screen that we were developing from the x-ray film.
Right, yes.
And I got hooked on medicine. And I said, by age 16, I knew I wanted to be a doctor.
Okay.
So I went into medicine, and I became a doctor, and I admired my dad, and I came back and I worked with him for a while in Virginia, but we had some difficulties, not very severe, but it was a generation gap, really.
Well,
we didn't use that word.
Just back up a little bit now. Medical school. How did you apply to medical school? Who was in medical school at that time with you and things like that?
Well, actually, I went to Hampton Institute.
Right.
And I finished Hampton Institute in 1953. And Hampton Institute had an exchange program with some colleges up north, and one of them was Oberlin College.
Oberlin, okay.
And when I was at Oberlin College as an exchange student, I took a course in biology under Dr. McEwen, who wrote the textbook.
I see.
And across from my table, we had a table assigned for us to do our dissections in biology class. There were 4 guys who were going to this school called Western Reserve.
Oh.
And that's all they talked about, Western Reserve. And I said, I think I'd like to go to that school. It's in Cleveland.
Right.
And I applied, and I was accepted. And I got to Western Reserve in 1953 in September. There was one other black American there, and that was a Nigerian boy. But we were the only 3 in a class of 80 students.
I see.
The Nigerian kid dropped out, and I'm not sure what happened to him, but anyhow, my colleague and classmate Maxie Malsby and I graduated from our class, and Maxie became an outstanding psychiatrist.
I see.
Has written a number of books in psychiatry.
I see.
And has made some very major innovations in the psychiatric field.
Now, Western Missouri was a medical school, is that right?
Of course.
Yes, right,
yes,
okay.
yes.
Because a lot of folks, they only think of certain medical schools. They don't know medical schools are in Ohio or different places.
Well, now it's called Case Western Reserve.
Right, okay, yes.
Right. And then when I finished, I came to Grasslands Hospital in Westchester County. It's now known as the Westchester County Medical Center.
Right.
And that's where I did my internship.
Okay.
Finished that in 1958 and straight back to Virginia to work with my dad. And I worked with my dad for just about 6 months.
I see.
And it was such a generation gap. We didn't have a real conflict. My dad was a wonderful man, and he helped me through a lot of crises.
Right.
But I was having problems collecting on the bills and the way he had practiced medicine. So my friend Malsby had gone to Florida, and he said, look, if you want to serve the people, come to Florida and serve the people. And you can also make a little money, which wasn't a bad idea. But anyhow, I went to Florida, and Malsby was in Cocoa, Florida, and I went over to Melbourne. And I had a wonderful practice in Melbourne. My dad eventually came there and visited me and said, you made the right decision. Well, I had a couple of episodes in Florida, and they're very tragic, that made me determined to go away and study surgery. And one of them was a boy who was in an accident, had severe abdominal pain, and I called the surgeon. And the surgeon said, give him some IVs and call me back. He was on the golf course. And I called him back and I said, doctor, you better come and see this boy. He's in a lot of pain, and I'm giving him some IVs, and I'm doing everything you said. He says, well, do something else. I've forgotten what he told me to do, and I'll check him later. Well, his colleague happened to wander into the hospital for some reason, this fellow who was on the golf course. He had a surgical colleague. And I said to his colleague, I said, doctor, I have this boy who was in an automobile accident. And I said, I've been calling this other doctor, and he's out on the golf course. And he came over and looked at him. He said, Jim, we've got to get him to the operating room right away. And he had a ruptured duodenum, and he died.
Oh, wow. Yeah.
So I said, I'm going away and study surgery and come back. Well, so I went to Queens General Hospital, and I studied surgery from 62 to 66.
Okay.
In 67, I got my boards. But then the war had heated up in Vietnam, and I was 35 years old, and I was drafted. I was drafted, Dr. Deas, to go into the service.
Right, yeah.
Well, you see, again, I want to remind you, I came from a small town, right?
Right, sure.
The guy who was on the draft board, his father was my father's colleague in medicine.
Right.
They all knew everybody down there.
Right, sure.
And he calls me on the phone. He says, Jimmy, he says, look, I've been holding off as long as I can. I wanted you to finish your residency. He said, but I've got to fill my quota. And the government is on my back to get men up to the service. And you've got to go in, Jimmy. So you either I'll draft you, or you should volunteer for a branch of service. So I volunteered for the Navy. Then I went into the Navy, and after I came out of the Navy after 2 years, I felt that to go back and do general practice and surgery, I just didn't think it would work well. And at that time, a position opened up at the Tuskegee Veterans Administration Hospital as chief of surgery. So I went there, and I became chief of surgery at the Tuskegee VA Hospital. Well, again, I had problems I couldn't solve. And I said, if I had additional training, I could help these people. And mainly, it was there were veterans who needed reconstructive surgery. And I said, I'm going away and study plastic surgery and come back to the VA. So I was in Alabama. I left Tuskegee, Alabama in 1972, went to the University of Michigan. I wanted to go to the best plastic surgery program in the country.
Right.
I wrote a friend, and he told me the best programs, and I only applied to the best programs.
Right.
Because I believe in shooting for the stars.
Yeah, I know that. I know that.
So I got into the University of Michigan, and I finished my residency, and I was thinking of going back to Alabama. And then, of course, I was married, of course, and I had a child.
I see.
And my wife says, I'm not going back to Alabama. She
Right.
said, you can go back to Alabama, but I'm not.
Mhm. Okay.
So I said, well, where would you like to go? Well, my wife happens to be Japanese. So she said, you can go Tokyo. Tokyo now, listen to that. San Francisco, New York, or Paris. 4 choices. Well, I already had a New York license from my residency
Sure.
here in Queens, so I came to New York.
Mhm.
And the plastic surgery part goes back to my building because,
Oh, yes.
again, so much of plastic surgery is innovation, building, putting things together,
Yeah.
putting parts back together.
Mhm.
And that's where the building came back. So it was kind of going full circle.
Yeah.
Yeah. So I've been here since '74, Dr. Deas.
Well, you know,
Yeah.
our lives parallel. So,
Mhm.
because when you were going one place in '58, I was just going to medical school in '58. You know, at Downstate. Here,
Right,
you
right,
know?
right,
And
right.
I was drafted right out of my master's degree to go into the Korean War. And
Right.
Of course, you know, that was before the Vietnam War, of course. And I had to stop everything, go there, do my duty there, and so forth, and come out and follow my dream also, married and everything else too, you know. So we have such a kind of a, when you start out in life, it's never a straight line,
That's
you
true.
know.
It's-
I used to work with a Japanese when I was in Korea, and he said, I used to do things, he said, Jerry, he said, the shortest distance between 2 points is a straight line. He saw me going around in circles, you know, sometimes. He said, the shortest distance between 2 points is a straight line, you know, but our lines have never been straight.
It can't possibly be straight.
It's always...
It can't possibly be straight. There
No.
are too many extraneous factors coming in and entering into your life
Surely.
that influence your decision.
Surely.
When I went back to my hometown to work with my dad, I was sure that's where I would be for the rest of my life.
Surely.
But events weren't what I had anticipated.
Mm-hmm.
And thank God my dad told me later on, he came to Florida and visited me.
Right.
And he said, son, he said, you made the right decision. And I felt very good about that.
Right.
Yeah.
Now, during your plastic surgery career, I'm sure you had cases that you can still remember that. Well, what is the patient relationship to a plastic surgeon? What do they expect from you when you start working on them?
Well, the patients really, what they want to, let's talk about 2 kinds of patients. First, the cosmetic patient, which I did, and I think I did a reasonably good job with cosmetic surgery.
Right.
There are expectations, oftentimes, a little bit unrealistic. For instance, I had a patient to come in, and he wanted a nose operation, and he brought me the picture of a very famous actor. And he said, I want a nose like this.
Right.
I said, well, you're not going to get a nose like that. I said, I'm going to make, and so I took photographs of him, and I showed where I could make his nose look better,
Right.
and maybe take care of some of his concerns, but I'm not going to give him Denzel Washington's nose, and if he had Denzel Washington's nose, he'd look really funny.
That's right.
Well, you see what happened to Michael Jackson, right?
Oh, yeah, sure.
That was a case of absolute mutilation.
Yeah.
I would never have done to Michael Jackson what was done to him by plastic surgeon.
Right, yeah.
Absolutely never.
Fell into the wrong hands.
If it had come to me, I wouldn't have. I would, but see, that's a case of expectation and the doctor trying to do what he thinks the patient wants.
Yes, right.
So what you have to do is be very analytical and see what realistically you can deliver to that patient.
Surely,
Now,
surely.
when it comes around to reconstructive surgery, patients who have been burns, who have scars,
Right,
and
yes.
so forth, they just want to be restored to normalcy.
Right.
And I got to tell you, I have the nicest experience the other day. I called the young lady's mother. First, let me give you the background.
Okay.
The girl was 15 years old. She was in school. Another student sliced her with a box cutter from just below her ear all the way down to her chin, straight down.
Right.
Well, that's a terrible scar running straight down.
Surely.
So she came to me, and so I told the mother and the daughter, I said, this scar is going to be there for the rest of your life, but I said, I can do a procedure. At first it's going to look like I made it worse, but it's going to be better because the skin has certain lines, creases, and if the plastic surgeon's secrets about doing scar revisions, that's what you need with a scar revision, is to place your incisions so that they line the creases. So I said, I'm going to make a lot of little cuts all down this scar and align the creases. Mm-hmm. And so the mother understood and the daughter understood. We're talking now 17 years ago.
Right. And
I did the operation. And the other day, I just picked up the phone and I called the mother and I said, how's your daughter? She said, doctor, she's doing wonderful.
Yeah.
I said, well, how's her scar? She said, you can hardly notice it. I said, really?
Yeah.
She said, yes, she doesn't wear any makeup. I said, well, would you have your daughter call me? So the daughter called me and we talked about it and she told me that she was doing really well and she's going to come in and let me see her.
Right.
Because I like to have some fun. I have her original photograph.
Right, yeah.
I want to see how she looks, but it was so gratifying.
Right.
And then, of course, I had another patient who had a tumor on his arm. They thought it was a keloid.
Right.
A lot of doctors, when they see a thick bump on a black patient, right away they say, oh, that's a keloid.
Right, sure.
It wasn't a keloid. It was a cancer, skin cancer. It was called dermatofibrosarcoma protuberans.
I see.
And it's as bad as the word is long.
Oh, I know
And
those
he had
words.
already been operated on once and it had come back.
Wow.
And he had a little tumor, no bigger than the thumbnail,
Right.
when he came to me. Dr. Deas, when I finished with him, he had an area on his arm that big, and I reconstructed it with a skin graft. And I used a special kind of technique so that the skin graft would look approximately like his own arm.
Right, yes.
This was 18 years ago, and I called him the other day. He was at work.
Right.
He couldn't talk to me, but his wife called me back and said, he's doing fine, and I just want you to know that he's doing okay. And so I said, well, one day I'd like to see him. So she said, well, we can arrange that.
Right,
But
right.
it's the nicest thing that happened.
Right.
And
You know, I'm always interested too, not only for cosmetic sake, but when injury takes place. In the Kings County where I was at, or did my residency, people would come in with all kind of scars around their lips.
Yes.
You know, and that lip is such a sensitive thing.
Yes.
You know, and
Yeah.
I know you must have had a lot of experience with lips, and even replacing tissue where you might take a transplant from another organ, even to put up there to make it almost look like a lip and things like that.
Well, that can be one of the most challenging undertakings in plastic surgery. And I don't know whether you saw the picture of the lady who was bitten by whose face was practically destroyed by the gorilla.
Yeah.
And I don't know whether you saw that, but they did show the lower part of her face, and she doesn't even have what looks like a lip. It's very difficult to reconstruct those because those are special tissues. But I've done a lot of cleft lip, cleft palate work. You know, the children with the cleft lips, and particularly, and I've done that abroad as a volunteer surgeon. Mm-hmm. Plus, I've done a lot of lip surgery for a number of patients who are concerned about their lips because they protrude or they're uneven.
Right.
Or they have, as you say, they have scars. And sometimes you do have to take tissue from other parts of the body.
Yes, yes.
It's very challenging. But Dr. Deas, the eye is an amazing instrument when you think of it. If you are hanging a picture, and good picture hangers don't use a ruler, they just step back and look at the picture with their eye.
Right.
Because your eye can detect a millimeter sometimes difference, and you have that much difference in the lip on each side. The human eye will pick up that difference.
Right.
And a patient has those discrepancies like that. They want those discrepancies fixed.
Right.
And so that's the challenge in plastic surgery a lot of times, to restore normalcy.
You know, I wrote there's a book called about the face, how you can tell so many characteristics of a person by their face,
Yes.
you know, things like this. Have you ever seen your own face? And I always tell my patients, you know, especially when they're vain sometimes, I say, you know, when you look in the mirror, you have never seen your own face. You've only seen an image of your face.
That's true. That's true.
But you have never, you see my face, I
That's
see
true.
your face.
That's
But you have never seen your own real
You're
face.
right.
Yeah.
That's true. That's true.
And
Dr.
so,
Deas. That's true.
yeah,
How many people think of that?
That's right. So I said, if somebody's not engaging you and so forth, they might be looking at your face and you think I'm wonderful because I'm looking in the mirror and I must be a wonderful person, but they're seeing certain things in your face that they don't want to get too close to you, won't embrace you.
Yes.
And so this woman went around, studied faces and even the shape of the eyebrows, how the lips are formed, how the chin is formed, and picked out all these different stars and things, and that face fit those characteristics of that face, of how, we talk about Barack and his large ears and things like this, when we used to talk about it in large ears in medicine, we used to think of pernicious anemia. When you had big ears, you're going to be a pernicious anemia, a certain form of anemia and things like this. But I think that, the challenges that you have to face, the pressure as a plastic surgeon, it's not like a doctor listening to the heart and things like that. There's so many murmurs you can hear and so forth. But here you got to deal with this whole image that this person now wants to look in the mirror and be themselves again.
Right, sure.
And that's not so easy for yourself, especially if they're a keloid. Maybe just a moment, just talk about that keloid that African Americans are subject to.
Well, keloid is a condition that where the body apparently loses control of the scar tissue, and the scar tissue grows beyond the boundaries of the original injury. That's what we define as a keloid.
Right.
A lot of people come in, they'll have a scar following a cut.
Right.
Oh, doctor, I have a keloid, or my doctor told me I had a keloid. And it's not a keloid, it's what's called a hypertrophic. Hyper means elevated.
Right.
Trophic means thickened scar. But in the keloid, the scar will actually grow beyond the boundaries. And I've seen patients who started with maybe a little scratch in the sternal area, in particular has a proclivity to occur in certain areas of the body, particularly in the sternal area. And it'll spread out to become a large area. Sometimes I've had them as large as the palm of your hand on the chest. That started out just from a little pimple.
Yes.
And it's not cancer.
No.
They're not cancerous, but they have a tendency to grow, and then the doctors operate on them, and they come back with a vengeance sometimes.
Yes. Right.
So there are methods to control keloids, which we won't have time to go into today, but perhaps we could have another session on that.
We'll talk about that, surely.
But it is a very distressing condition for people.
Well, I've never let my daughter pierce her ears because I've seen keloids on the ear that hang like an earring.
Well, Dr. Deas, I think the ear piercing of the ear is something that has to be taken very seriously, particularly in adults. It's interesting. I have very, very rarely seen a keloid in an infant, a piercing following infancy. When the piercing was done during infancy.
Infancy, I see.
During infancy.
Right, yes.
But when the problem has been when these young ladies and young men sometimes want a second hole. Well, the men want a first hole, and the ladies want a second hole, a third hole. And that's when they get into trouble. And that has to do with, we don't understand fully the pathophysiology of why that keloid will occur at a later age rather than in their infancy. But that's one thing I've cautioned people about is ear piercing in adults.
Well, I see them with their nose, the nose piercing, the lip piercing. And young people just don't realize that this could go into a major problem in their life.
May I comment once about the lip piercing, because this is really important. I've not seen, rarely have I seen a keloid from a lip piercing.
Right.
But what happens in the lip piercing is, in order to have the lip piercing done, and of course you have to wear a little not an earring, but a little piece of jewelry in there. And there has to be a stud on the inside. Is that right?
Mm-hmm. Yeah.
Okay. You know what that stud does to the gum? It erodes the gum around the tooth.
Is that right?
And I have a remarkable photograph of my nephew, who was a young man who had his lip piercing. And he came in, I was astonished. And I asked to look at his gum, and the gum had eroded and was beginning to erode around the tooth. What eventually happened is that the tooth will extrude.
Right, yes.
from loss of gum tissue and gum support. And
Well,
so I showed him the photographs, and right away he removed it. But this is something that should be taken very seriously.
well, I'll tell you, Dr. Nard, what we're going to do, because time is our enemy, but we're
Yes.
going to have to continue this conversation,
Yes.
because we're going to just have to continue this conversation because it's such an importance
Yes.
of what you're talking about now, because young people are looking and having tattoos and all these kind of things, and they don't realize ultimately if they wanted to have them removed, what it'll take and things like that, and the money and things like this. You know,
that's a session I think we really ought to have
so we're
sometime,
gonna
Dr.
we're gonna
Deas. I
have
would
that
appreciate
at another time. But I'm just so glad you appeared with me this morning here.
Well, thank you,
know,
thank you.
or the time that we can discuss these things. But we're going to come back in another session immediately following this one to discuss your dad being that country doctor.
Well, thank you.
And then
Thank
we'll do other things. But so you folks out there, listen for the next time. See us the next time we talk about plastic surgery.